And welcome to the Shatkin F.I.R.S.T Monday Morning Minute.
Hi, I'm Dr. Todd Shatkin, and welcome to this Monday Morning Minute. Today we're going to be extracting infected tooth number 19. It's an old root canal that has apical abscess, periodontal and periapical endo abscess, periendo abscess. You can see it right here on this screen. And the tooth itself is cracked and broken down pretty badly. So we're going to take this out. We're going to very carefully remove the roots and clean out all the infection that's inside the root areas. We're going to curette those really well. And then our plan is to place a 4.2 millimeter by 13 millimeter mono implant right in the furcation area between the roots. And then we're going to pack some Restore Plus pure bovine collagen bone around the implants, and we're going to use a new product called Ora-Aid as a tissue bandage over the top of the implant and the bone graft. And we'll be doing that all here this morning, so please enjoy the Monday Morning Minute. I'll be right back with you. Can you see it from this angle here? Come from back here. The tooth is really broken down and cracked, and you can see it's split completely in the middle. So we're going to get that tooth out, and there's a lot of infection. Okay? You can slice that in, right?
Yep.
So I'm not sure what that camera's
Skip.
All right, we're going to go ahead and elevate that tooth out. There's most of the tooth. Now we got the rest of it. Okay. Now we're going to curette that out and make sure we get all the infection out. There's a large amount of granulation tissue in there that we cleaned out. Okay. Now we're going to go ahead and place the implant.
You can get in here.
All right, so we're going to use a 1.5 pilot drill. I'm going to open really big. I need a drill extender to get in there. Light this one out. Can you give me the light, please? Perfect time.
Bite together for a second. You can bite for a second. Give your jaw a little rest.
So here, we're going to use the Ora-Aid and the Restore Plus and the Hemostip. Open real big. Okay. Now I'm going to increase to a 2.0 drill because I'm using the 4.2 millimeter mono. I've got the first hole right, the first pilot hole in the right in the interseptal bone. Now I've just increased the size up to a 2.0, and you can see the bone on the drill itself. That's a good indication that we've got good bone there. So now we're going to take the implant. And there's our 4.2 millimeter mono implant. I'm going to start by hand threading it into place. And because we're using this in a first molar, we're using a non-bendable design, mono. I'm threading it in. Now we're going to take the carrier off of the implant. So we take the carrier off. And now I'm going to use the contra-angle driver to place the implant at setting number 2. Okay, and now we're going to go up to setting number 3. Okay, perfect. That looks really good. Now it beeped at 30 and 60 Newton centimeters of torque. Right together. Can you get in there and see that? You'll see that there's clearance, about 2 millimeters of clearance between the abutment and the opposing tooth, which is good. Okay, open for me. Now what we're going to do is I'm going to pack the socket with a Restore Plus bone. There's a Restore Plus. It's 100% pure bovine collagen, Achilles tendon collagen. And we're going to pack that into the extraction site where we completely cleaned out that granulation tissue. That's very important. You want to get all the granulation tissue out and then pack your bone in there. And I'm going to use one more piece. So I'm using 2 bone plugs. Here's the second one. What I like a lot about the pure bovine collagen plug is it doesn't resorb quickly. It takes time, and that allows the bone matrix to form and form a clot, and actual bone formation occurs very quickly. In addition, it helps the soft tissue heal. There's a lot of research out there that shows that the pure bovine collagen actually helps the soft tissue heal very rapidly. It's a huge advantage. And it preserves the architecture of the soft tissue as well. So now we're going to put some hemostip on top and around that. I usually like to break these in half. So I take one piece and I'll pass that on top of the bone. And that also helps to form a blood clot. It's also antibacterial, so it helps heal. So now we've got that. I'm going to put one more piece over that. I'm going to bring Dr. Jarrett in here because he's had a little more experience with the use of the Ora-Aid. So I'm going to let him demonstrate how that's used over the entire area here. I just have him bite for a second.
I'm going to show how to use the Ora-Aid, the oral band-aid from Ora-Aid. So I'm going to cut a little hole inside of it. This is to go around the implant. I'm going to take it off. We got a little hole there. You could also just stick it on and pierce it through, but it's a little easier this way. And just flatten it off.
You got the implant through there?
Yeah. And this should cover the extraction site. I like to take Explorer, the perio end of it, and just push it all the way down. And there, now you're not gonna get any bacteria in that socket. It's gonna be nice and clean. It's going to make it easier for the temp to come off. It's going to be a smoother temp without undercuts. It's a really good. Yeah, see Todd.
Oh, that's really cool. Yeah, I've never seen that, Jared. That's really cool. It's a great product.
Yep.
I like it. Look at that. It keeps the clot in, it keeps the bleeding away.
You could use it for denture stabilizations. When you do the pickup with the Ora-Aid on, it blocks out any of the undercuts that you'll get the first time you pick up the denture.
temporary?
Yes, I can.
And now, you know, just make it temporary, nothing too complicated. Just leave it completely out of the bite and let this implant integrate. My favorite instrument in the cassette is my fingers, but I'll use that too. Okay, bite down for me. That's out of the bite. Let me see the back. I want to make sure that's smooth open for me. You can also kind of cut this a little bit. Here, you can cure that. No. No, I don't need any more. I'm just gonna trim the Ora-Aid around the other tooth so it doesn't. Not that it's that big of a deal if it does. So it's not on the other tooth. I think it's out of its bite. Okay, all right, let's check the bite. Bite down for me. Yeah, it's out of its bite. Nothing, you're good. It's been a Monday Morning Minute.
This is our post-op x-ray. You can see the nerve canal here. And if we scroll across, you can see where it exits here. We're lingual to the nerve and we're at least 3 or 4 millimeters away from the nerve. This is a 5.0 by 13 mono. And you can see it's 5 millimeters at the top here. If I measure this, you'll see the width here, right at the widest point. Five millimeters. And if you look at I think it's important to know the distance at the tip. So it's only about a little over 0.5 millimeter at the tip of the implant. So it's 5 millimeters tapering down to about 0.5 at the tip. And we use the Ora-Aid dressing over the Restore Plus bone, and this worked out beautifully. Thank you very much.
Take advantage of our end of the year special with the brand new Ora-Aid, the intraoral wound dressing that works absolutely phenomenal. So if you buy 3 boxes, you get 1 free. So that's $80 for the price of $60. So visit ShatkinFirst.com, or you can call in and talk to any of our sales reps.